Kenji Shibuya. He's a professor and director of the Institute for Population Health at King's College London. He's also the former chief of health policy at the World Health Organization. Kenji, thanks so much for joining us here at TRT World. Now, as we just mentioned with Stephen there, Tokyo residents are now asked to stay at home. Do you think this should have been done earlier by the government?
Yeah, somehow Japan managed to contain the number of cases of deaths low compared to other countries so far. But I think that yesterday's sudden surge of confirmed cases is a warning sign. And there has been two possibilities. One is Japan has contained the spread by focusing outbreak clusters of infected people. The other explanation was that there are outbreaks yet to be found because of the limited capacity for testing. So there are both two reasons are reasonable, but I think there is a potential of community spread, and there is a potential for exponential growth in transmission.
Right. I was reading some of your articles in the past few days. You have warned that Japan might see an explosion of cases in the future. Now, so what do you make of Japanese government strategy in dealing with this outbreak, and why is Japan so limited when it comes to testing?
I think so far the Japanese government has done a great job on the ground to identify cases and isolate them one by one. But again, if you look at the situation in Hokkaido, they successfully contained the outbreak there. But the problem was because of the limited capacity of testing, it's a capacity and also the willingness to expand the coverage. There seems to be hidden outbreaks, and I think Japan is about to see the potential explosion of outbreaks, particularly in big cities like Osaka or Tokyo.
And Kenji, I do want to ask you, because you are a former chief of health policy of the World Health Organization. In your opinion, has enough been done by the governments across the world in preventing this outbreak?
That's a very good question. WHO has been advocating a very simple message from the beginning: test and isolate, and also strong leadership of the government, and if necessary, government has to act across the implement the whole of the government approach. And that has been the most powerful message. But yet, each member state or government has responded differently, partly because of their internal politics and partly because of their situation with respect to other countries. So I think there was a lack of international cooperation there. So it is time to go back to the basics and work together.
Much for that, Kenji Shibuya. He's a former chief of health policy at the World Health Organization. Thanks so much for that insight for us here at TRT World.